Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I'm going to tell you the dark side of NEET PG specialty selection. So what are the negatives in each specialty I would like to cover, and 23 specialties negatives I'll tell you. So let us start with general surgery without any time waste. General surgery, the main negative is that you require a lot of stamina. If you have a good physical stamina and endurance, only then you enter, because it is going to be very physically tasking, and the surgery should be longer. And what I observed is, in India, from admission to discharge, everything somehow it will depend upon a surgeon only. So you need to have a lot of stamina and capacity, only then you can endure your post graduation as well as in future. Okay, so that is what, because I closely work with surgeons, I know actually what kind of capacity they need to have. And if you don't have such kind of a capacity, then please don't enter. So that is my recommendation. General medicine, the main negative is that, see, these are the things people wouldn't tell actually. So very sedentary work pattern might be there. So is what I feel. So mainly they'll be sitting all the time and looking at the OPDs. The negative is that if you sit for a long time in OPDs, you might actually develop some element of back pain, poor posture, and obesity, and all those diseases. But if you maintain your fitness well, if you exercise in the morning and all that, you can still overcome that. And this is one negative. And a lot of gray zones are there for general medicine, because they'll have gray zones with family medicine, they'll have gray zones with MBBS people, they'll have gray zones with multiple other specialities. Gray zone means that their cases will be dealt by other people also. That is a main negative for general medicine. Okay, but otherwise it's a super specialty. I always recommend, right, in my videos, to do general medicine than any other specialty. So pediatrics, the main negative is that treating kids is fine, but dealing the parents is very tough, because they actually ask a lot of questions and then they eat you off. So that is the main negative in managing pediatrics. If you have a lot of patients, only then you take. If you don't have patients, please don't enter pediatrics. You might be compensated well, you can have a successful OPD, but everything depends upon your patients. Patience is the key in pediatrics. Okay, but otherwise there's a lot of scope in all these specialties that we discussed. We're only discussing negatives, right? So let us stick on to that. OBG, the main problem is that you have to be 24 hours on call, because when you admit a patient in your name, you be in a corporate or a private or a clinic or wherever you're working, that patient will expect you only to come in the night also. So 24 hours you will be in the hamster wheel. So it is going to be disrupting your personal life also. But if you're ready for such kind of a lifestyle, and if you're passionate about that, and then you can actually take up. But if you are a kind of person who are looking at work-life balance, this is not the specialty for you. Again, like general surgery, a lot of physical endurance is required, and a lot of malpractice lawsuits also are there on OBG people in India particularly. Let's go into orthopedics. The negative side is that you need to have a brutal force in doing the procedures. So mainly will suit men, and in men also, if you're a little muscular guy, it would be better. So that is one negative of this field, and it is pretty saturated. I did a video also on that. So a lot of competition is there in metros, and in every level there is competition. That is the main negative in orthopedics. Okay, otherwise it's a good specialty. Dermatology, the main negative would be the expectation of patients actually unrealistic nowadays. So if you're on cosmetic side, you're even more finished. If you are going for some kind of a hair transplant or a nose, or some kind of a skin disease or something, the same thing applies to plastic surgeons also. Expectations are damn high. Even if slightly things go out of their expectation, they wouldn't actually understand the situation. They will keep coming to your OPD and they will irritate you. So what I feel is, the main problem is that otherwise, looking at the scope, futuristic, and if you become successful, it will be a very cool branch, no night duties, all the advantages are there. But this is one problem, and you have to keep always updated with the latest things going on, because if you don't know, some new kind of laser is coming or some new kind of thing is coming in USA, you have to be updated all the time. It's not like anesthesia or some other field where you learn some basic stuff, and if you do things safely, you'll be valued more when you're updated in dermatology or cosmetic side. Psychiatry, the main negative is in India still the stigma is there. So patients even, they have a psychiatric disorders only when it is like obvious and people come to know, only then they come. Otherwise, so small things, they're not coming even now. So that is one thing. And a lot of, emotional toll will be there dealing mental illnesses. So that is the main negative. Otherwise, setting up an OPD and all that is working out. There is some element of competition, but still I feel it's a pretty reasonable branch to do. I've done a video on psychiatry. You can check out that video. Now child and adolescent psychiatry has a very good scope in metros, okay, because many kids are actually getting autism and all that after COVID. So coming to radiology, main disadvantage is patient interaction is not there. So you have to sit in front of system. Again, like general medicine, what I told, back pain and all those problems might come for you. If you're okay with that, and if you're like, say, if you're okay with technology and monitors and scans, then fine. But the thing is like, you will not have any interaction with the patients. That is a negative. And radiation exposure is significant in interventional radiology. Okay, so cancer risk will increase, and that is a problem. Anesthesia, the main problem is you need to know how to manage crisis. If you do even the slightest error, actually you'll be stuck in a situation. A lot of medical legal implications would be there because the branch itself is very critical. Okay, an emergency would be there and a lot of duties are there. So your circadian rhythm will be taken for a toss. That is the negative of anesthesia. And underappreciated, as you know that the field is a little underappreciated. It is dominated by the surgical specialties and the other physicians and all that. Even your intensivist also, even intensivists are actually having the same problem of dominance by other admitting clinicians. So this is the problem for anesthesia. Pathology, the focus is on laboratory work. There won't be any kind of patient interaction, so that is a main negative. And diagnostic mistakes will have very serious implications, and you think you will be safe, but you might be sued also for that. Okay, but it's more of repetitive kind of work you do every day. So job satisfaction is not very much guaranteed. Okay. Ophthalmology, main disadvantage of ophthalmology is that the investment cost is very, very, very high. If you're planning to set up, you have to work in some kind of eye centers, and again you have to work for salaries, and a lot of saturation is there in market for ophthalmology. That is why I don't do many videos on that. ENT also is the same. ENT, a lot of saturation in the market. Since ophthalmology and ENT have been age-old specialties, so many people have already come and they saturated the markets, and there is no much subspecialties in these things. Anterior chamber, posterior chamber and all these things are there in eye. But in ENT though, there is a lot of gray zone, this rhinoplasty and all those surgeries. Many people actually do. The subspecialization is not very significantly there in ENT. So a lot of gray zones are there, and competition is significant. If you want to set up an OPD in some kind of a metro, it's going to be very, very, very tough in ENT. Okay. Then we'll go into community medicine. In community medicine, what is going to happen is even you become a very successful community medicine person, WHO, UNESCO, you do a lot of travel would be there. So what happens is if you have a family or if you have some kind of kid, if you have to take care of kids, and every time if you have to travel to some country and all that, it would be very tough. And then if you are working as a faculty in a hospital, then you will be on a salary basis. Okay, and most of the focus would be on public health initiatives and individual patient interaction, all that you would miss. So that is the main negative of community medicine. Emergency medicine, I would like to tell you now, it is more like constant exposure to the mob and all that. So a lot of violence is involved. So they are the first ones who actually get beaten up in any kind of mob attacks and all that. Irregular work shift, just like anesthesia. So circadian rhythm is taken for a toss. Otherwise, it's a good specialty and emerging one. Physical medicine rehabilitation is more like, you don't see any result actually immediately. So you need to have a lot of patience, and, still the corporates are actually not valuing the branch that much. But over a period of time, you might get a very good recognition. So that is the problem for physical medicine rehabilitation. So next is nuclear medicine. Nuclear medicine is a very good specialty, but the thing is you have to handle radioactive isotopes all the day. Some potential health hazards can be there. And then you need to have access to sophisticated technology, and very few centers can give you jobs. So that is the problem. Even radiation oncology also same problem. Getting a job would be tough. Once you get, you will grow. Microbiology and other laboratory specialties have the same problem: less job satisfaction and repetitive work, so fewer opportunities. Most of the hospitals are filled with faculty, so very difficult to get jobs into assistant professors and promotions and all that are very difficult because they've been age old branches. Forensic medicine, I personally feel that it is more like dealing with deceased, so and court cases and legal documentation, all that is part of it. You'll get used to it, but that is the main negative in that. And anatomy, physiology, and all the specialties may require a lot of inclination towards teaching, research, and all that. And fewer positions are available in many educational institutions. So but you should be able to relocate to some place in medical college to get a job. If you're okay with that, you might get a good job in other hospital. I have a video in my channel I have done on all the specialties. Family medicine scope might be good in future, but at present it is more like gray zone. So people wouldn't understand what a family medicine physician would be doing at present, but slowly it will improve over a period of time. Financially, corporates wouldn't immediately hire family medicine physicians because general medicine people are available now. But if you can actually collaborate with some gated communities and build your own patient base, corporates would be ready to hire you if you have a patient base. Transfusion medicine is a good specialty, but you have to be very careful and a lot of rules and regulations. No error should happen in blood matching. Even if slightest error happens, you will have to face the consequences. So you need to have you should be a perfectionist and very meticulously doing this stuff. Okay, and sometimes if blood group is not available, you should have a lot of contacts, and you have to arrange blood from that blood bank, this blood bank. You should have contacts in all the blood banks and all that. If you have such kind of collaborative mindset, it would work out. Otherwise, it will be a tough specialty. So last but not the least, palliative medicine. It is still, people are understanding what palliative medicine is. That is the problem with that. So centers like onco centers and other centers are hiring people, but the packages wouldn't be very high because the role that the palliative physician takes, still we are trying to understand what they actually do. But palliative medicine will have a lot of scope if you actually go for a senior citizen facilities, or if you're actually developing some kind of entrepreneur franchise kind of model of senior citizen facilities and that, which are going to come up. I know personally many big companies are actually working on developing senior citizen facilities in India. So they would require a lot of PMR, palliative and all those clinicians. But in the beginning only, if you can actually do and collaborate with one of the companies, then you will have a very good lead position in that. So this is a conclusion, guys. Every specialty would have a set of challenges. That's what we discussed now. But I think we should not think about the negatives and go in well-rounded decision I want you guys to take in the choice filling and taking up the specialty, and then you will have a very good future. So thank you all for watching the video till the end.